This is a very brief presentation for Module 617 Module 2. Heterogeneity in genetic makeup contributes to many variations in pharmacokinetics. Most drugs are metabolized through the cytochrome P450, also known as the CYP450 enzyme system. Differences between poor metabolizers and extensive metabolizers impact provider management. So let's do a little review of pharmacogenomics. What is the definition of pharmacogenomics? That is a branch of pharmacology that deals with the influence of genetic variations on drug response in patients by correlating gene expression with a drug's efficacy or toxicity. So a review of the CYP450. CYP450 enzymes are involved in about 75% of drug metabolism and bioactivation in the liver. Some CYPs or cytochromes metabolize only or a very few drugs, whereas others may metabolize multiple drugs. Genes provide the coding for those CYP enzymes, and the enzymes themselves are designated by the CYP abbreviation. So that tells you everybody will not metabolize drugs the same, right? Because everybody has different genetic makeup. So I may metabolize drugs one way and Mr. Smith metabolizes them a different way. And that's very important for providers to understand, okay? Clinical knowledge of substrates, inhibitors, and inducers for each CYP450 family assists clinicians in predicting potential drug-drug interactions. So things like race, gender, environmental factors, and drugs may alter the gene expression of individual CYP450 families and subfamilies. The CYP3A subfamily is responsible for over 50% of drug metabolism. Now, am I going to ask you to know which drug is and which CYP450 person is going to be affected? No, it won't be down like that. But you do need to have a very good understanding of the CYP450, okay? Because that will affect how you prescribe. About 40% of Asians display drug polymorphism. So definitely when prescribing to Asian or patients of Asian descent, then we have to think about the CYP450 guidelines. There is no specific clinical test to estimate the sensitivity or activity of the CYP450. So it's not like you can just say, oh my God, okay, let me go and test all my patients and then I can figure this out. No, there is no test to figure it out. Now let's talk about inhibitors versus inducers. So what are the clinical implications when substrates inhibit CYP450 enzymes? Any inhibitor may decrease the metabolism of substrates and generally lead to an increased drug effect. So, listen to that again. The clinical implications when a substrate inhibits CYP450 enzymes. An inhibitor may decrease the metabolism of substrates and generally lead to an increased drug effect. So it decreases the metabolism and then it increases the drug effect. Now, what are the clinical implications when substrates induce CYP450 enzymes? An inducer may increase the metabolism of substrates and generally lead to a decreased drug effect. CYP families 1 through 3 have the least affinity for substrates and have the widest genetic variability. They're responsible for about 78 to 80% of phase 1 metabolism drug interactions in clinically used drugs. Variations or polymorphisms in genetic codes for these CYP enzymes have tremendous clinical importance. So there's variations in phenotypes that affect the speed of metabolism. So if we talk about poor metabolizers, that's homozygous for lack of a working enzyme. Okay, so poor metabolisms have a lack of a working enzyme. Intermediate metabolizers, heterogeneous for one working wild type L and one mutant L. So there's an intermediate. So they have one working like wild type, okay? Extensive metabolizers, homozygous, have two normally function Ls, okay? So intermediate has one wild one, extensive has two normally functioning, and the ultra rapid metabolizers, they have more than one functioning copy of a certain enzyme. And the reason I'm going to go over carbamazepine, I never say that right. Carbamazepine, there we go, carbamazepine. FDA labeled is recommending testing for the HLA-B1502L in patients of Asian ancestry before initiating carbamazepine therapy because of the high risk of developing carbamazepine-induced Stevens-Johnson syndrome or toxic epidermal necrolysis, which is also TENS. That was a lot to say. And it's carbamazepine. Sorry, guys, if I messed that up, but it's important. So if you're going to prescribe something like carbamazepine and you have patients of Asian descent, well, the FDA is recommending testing for the HLA-B1502L of patients of Asian ancestry before initiating carbamazepine therapy. Why? Because there is a high risk of them developing Stevens-Johnson syndrome or TENS, which is also toxic epidermal necrolysis. Okay, it was brief. That is the end of the lecture for Module 2.